A 19-year-old cat Madison was given a dose of Librela meant for a 200-pound dog. What happens next could affect her kidneys, her brain, and even her life. This is what every pet owner needs to know. This is Madison. She's a 19-year-old Scottish fold cat, and she was given the wrong medication. Not just slightly wrong, the highest dose meant for a 200-pound dog. The drug? Librela? A medication that is not approved for cats. So what does this mean for her? And what should you do if something like this ever happens? Let's break it down. What is Librela? Librela is a monoclonal antibody used in dogs to treat osteoarthritis pain. It works by targeting nerve growth factor, basically, blocking pain signals at their source. It recently killed my darling chocolate Labrador Shadow. This drug is for dogs, but here's the problem. Cats are not small dogs. They have completely different metabolism, immune responses, and drug sensitivities, and Librela has not been approved or properly studied in cats. What makes this case high? Risk. Madison isn't just any cat. She's 19 years old. At that age, kidney function is often already reduced. Liver processing is slower. The body has less ability to compensate. Now add in a drug not designed for her species, at a dose meant for a giant dog. This creates a situation where effects are unpredictable and serious, possible risks and side effects. Because this drug is a monoclonal antibody, it behaves differently from typical medications. It's not processed like a normal drug. It stays in the body longer. Risks include kidney stress or damage, immune system reactions, neurological changes like weakness or unsteadiness, appetite loss, vomiting, or lethargy, and the hardest part, some of these effects may not show up immediately. They can take days or even longer, months longer. What tests should be done? Immediate monitoring is critical. Baseline tests should include full blood panel, kidney markers like creatinine and SDMA, liver enzymes, electrolytes. Also, urinalysis to check kidney function, blood pressure monitoring. And these tests shouldn't just be done once. They should be repeated over several days because damage can be delayed. What about ADMSA-SCAN? You might hear about something called a DMSA scan. This is a specialized test used to assess kidney damage. Yes, it can be done in cats, but it's not usually the first step. It's more useful later if there's concern about long-term kidney injury. Signs to watch for at HOME. If your cat has been exposed to the wrong medication, watch closely for loss of appetite, vomiting, lethargy, increased drinking or urination, weakness or wobbling. If you notice any of these, seek veterinary help immediately. Don't wait. Advocating for Madison. This situation is incredibly difficult, but here's what you need to remember. You have the right to ask for full monitoring, request repeat blood tests, seek a second opinion, and most importantly, you are your pet's voice. If something feels wrong, speak up. Madison's story is still unfolding, but by sharing it, we hope to help other pet owners avoid the same situation, or respond quickly if it happens. If this video helped you, please share it, because awareness can save lives, and Madison deserves that.